What if your body is screaming warning signs at you every single night, but you're literally sleeping through them? There are 8 specific nighttime symptoms that could indicate your blood sugar is in the danger zone right now. And according to recent medical data, most people ignore them for months, even years, before it's too late. Here's what makes this critical. Studies show that nighttime hypoglycemia occurs in up to 50% of people with diabetes, yet 70% of these episodes go completely undetected. Even more alarming, research published in the journal Diabetes Care found that severe nighttime blood sugar fluctuations triple your risk of cardiovascular events. While you're asleep, your body can't consciously alert you to danger the way it does during the day, which is exactly why these 8 warning signs are so vital to recognize. This video is for educational purposes only and not a substitute for professional medical advice. Always consult a qualified healthcare provider about your health. All information shared is backed by credible, peer-reviewed research, with links to the original studies in the description. Sign 1. Nocturnal hypoglycemia. We begin with one of the most dangerous and elusive signs of diabetes management, nocturnal hypoglycemia. This condition refers to a drop in blood glucose levels below 70 milligrams per deciliter while you are asleep. It is particularly insidious because the natural warning signs that would alert you while awake, such as shakiness or hunger, go unnoticed during slumber. The sleeping brain may not perceive these metabolic alarms, leaving the individual in a vulnerable state without the impulse to consume carbohydrates. This is most common in those taking insulin or insulin secretagogues, but it can affect anyone with diabetes due to missed evening meals or excessive physical activity earlier in the day. When low blood sugar occurs during sleep, the body's physiological counter-regulatory response is often blunted. This means the release of hormones like glucagon and epinephrine, which normally boost blood sugar, is delayed or weaker. Consequently, the hypoglycemic episode can become prolonged and severe, increasing the risk of seizures, arrhythmias, or even dead-in-bed syndrome. A comprehensive review published in Diabetes Care in 2015 shed light on the long-term dangers of these events. The study found that nocturnal hypoglycemia significantly decreases the awakening response in the hours following the event. This impairment compromises a patient's ability to recognize low blood sugar in the future, creating a dangerous cycle of unawareness. The review highlighted that this diminished arousal from sleep delays necessary treatment, compounding the risk of neurological damage. Furthermore, a narrative review in Diabetes, Metabolic Syndrome, and Obesity from 2022 emphasized that this is a primary cause of sleep disturbance. It is closely linked to suboptimal diabetes outcomes and a heightened risk of severe cardiovascular complications. Sign 2. Night sweats. Moving to a more physical manifestation, we must discuss night sweats, which are often the body's desperate attempt to signal a crisis. These are not merely instances of feeling too warm under a heavy blanket. They are episodes of drenching perspiration that can soak through pajamas and bedding. This phenomenon is a classic autonomic response to rapidly falling blood glucose levels. When sugar drops, the body triggers an adrenergic surge, releasing a flood of adrenaline to liberate stored glucose. This adrenaline also violently stimulates the sweat glands, resulting in excessive moisture on the skin. For many, this symptom is the only overt sign that a hypoglycemic event took place during the night. This is especially true for individuals who suffer from hypoglycemia unawareness, where the brain no longer detects the early internal sensations of low sugar. If you find yourself waking up consistently damp or needing to change clothes, it is vital to evaluate your overnight glycemic trends. This is particularly urgent for those managing their condition with insulin or sulfonylureas. Research supports the prevalence of this symptom. A comprehensive review in Diabetes, Metabolic Syndrome, and Obesity in 2022 noted that night sweats are frequently reported in the diabetic population. The review revealed that up to 84% of people with diabetes experience sweating during hypoglycemic episodes, making it a prominent clinical red flag. The amount of perspiration is often proportional to the severity and duration of the glucose crash. This underscores the need to treat drenching night sweats as a medical data point rather than a simple annoyance. Sign 3. Nocturnal seizures. A terrifying progression of untreated nocturnal hypoglycemia is the onset of nocturnal seizures. These seizures occur because the brain is being deprived of its primary fuel source, glucose. When blood sugar drops critically low, it leads to a state of neuronal hyperexcitability, where brain cells begin to fire chaotically. This lack of metabolic energy lowers the seizure threshold, potentially triggering convulsive activity during sleep. Unlike typical epilepsy, these events are purely metabolic in origin and indicate a profound instability in blood sugar management. These episodes may present as strange nocturnal behaviors, thrashing, or severe confusion immediately upon waking. In some cases, they are misdiagnosed as primary epilepsy, which can lead to ineffective treatment with anti-seizure medications instead of glucose management. Recognizing the metabolic root of the seizure is a matter of life and death. According to a comprehensive review in the journal Seizure in 2022, hypoglycemic events can closely mimic focal seizures. The literature notes that early morning seizures were prominent in a significant number of reported cases involving diabetes. The review underscores that hypoglycemia must be the first suspect in the differential diagnosis of any nighttime seizure in a person with diabetes. Misdiagnosis delays the correction of insulin or medication dosages, leaving the patient at continued risk. Additional evidence published in Frontiers in Neuroscience in 2025 further highlights this danger. The study observed that specific EEG changes and clinical seizures become apparent when glucose levels fall below 60 milligrams per deciliter. This data confirms that hypoglycemia is a major cause of acute symptomatic seizures requiring immediate intervention.
Sign 4. Obstructive sleep apnea. There is a profound bidirectional relationship between diabetes and obstructive sleep apnea, OSA. This condition is characterized by the recurrent collapse of the upper airway during sleep, which physically blocks airflow. This blockage leads to intermittent hypoxia, a state where the oxygen levels in the blood drop repeatedly throughout the night. For a person with diabetes, particularly type 2, this oxygen starvation is catastrophic. The stress of suffocation triggers the sympathetic nervous system, flooding the body with stress hormones that worsen insulin resistance. This creates a vicious cycle where diabetes increases the risk of sleep apnea, and sleep apnea makes diabetes much harder to control. The nocturnal hypoxia promotes systemic inflammation and hypertension, drastically increasing the likelihood of cardiovascular events. It is not just about snoring, it is about the metabolic chaos caused by oxygen deprivation. According to a review in Diabetes, Metabolic Syndrome, and Obesity in 2022, the prevalence of OSA in adults with type 1 diabetes was found to be as high as 51.9%. The same review noted that moderate to severe OSA was directly associated with higher HbA1c levels, indicating poor long-term blood sugar control. Furthermore, OSA is independently associated with a nearly 1.5-fold increased risk of developing diabetes in the first place. A systematic review in the Journal of Clinical Medicine in 2025 confirmed these severe associations. It established that OSA is a major contributor to poor metabolic control and diabetic complications. These complications include retinopathy and nephropathy, driven by the nightly assault of low oxygen on the body's vascular system.
Sign 5. Restless leg syndrome, RLS, and periodic limb movements during sleep. Restless leg syndrome, RLS, is a neurological disorder that manifests as an uncomfortable, creeping sensation in the legs. This sensation creates an irresistible urge to move the limbs to find relief. These symptoms typically worsen at night and during periods of rest, making the onset of sleep difficult. For people with diabetes, RLS is often comorbid with peripheral neuropathy, sharing similar pathways of nerve damage. The constant need to move prevents deep sleep, leading to chronic exhaustion and elevated stress hormones. Often accompanying RLS are periodic limb movements during sleep, PLMS, which involve involuntary kicking or twitching. These movements can cause frequent microarousals, pulling the brain out of restorative sleep stages without the person fully waking up. This lack of quality sleep directly impacts metabolic regulation, leading to higher blood glucose levels the following day. It is a condition that bridges the gap between neurological health and metabolic stability. According to a review in Diabetes, Metabolic Syndrome, and Obesity in 2022, RLS is significantly more common in the diabetic population. The review cites a meta-analysis showing that sleep difficulties, often driven by RLS, are associated with a 1.74-fold increased risk of diabetes. Treating the RLS has been shown to improve both sleep quality and glycemic control. Additional evidence from current diabetes reports in 2021 estimates the prevalence of RLS in type 2 diabetes ranges from 17.7% to 45%. This significant overlap suggests that anyone with diabetic neuropathy should be screened for sleep movement disorders.
Sign 6. Diabetic autonomic neuropathy presenting at night. Diabetic autonomic neuropathy, DAN, represents a failure of the autonomic nervous system which controls involuntary body functions. While this damage affects the body 24 hours a day, its symptoms can become particularly aggressive and dangerous at night. One manifestation is gastroparesis, or delayed stomach emptying. If a person with DAN eats dinner, the food may sit in the stomach for hours, leading to severe nausea, bloating, or vomiting while lying down to sleep. This not only disrupts sleep, but makes insulin timing incredibly difficult. Another nocturnal sign of DAN is pseudomotor dysfunction, which can present as either a complete lack of sweating or paradoxical excessive sweating. Furthermore, the autonomic system regulates heart rate and blood pressure. At night, DAN can cause orthostatic hypotension, or a failure of the heart rate to slow down during sleep. This places immense strain on the cardiovascular system during what should be a recovery period. A comprehensive review in Diabetes Care from 2003 detailed the wide range of nocturnal symptoms associated with DAN. The review emphasized that this form of neuropathy increases the risk of sudden death during sleep. This is often due to cardiac arrhythmias that go unchecked because the autonomic brakes of the heart are damaged. The narrative review in Diabetes, Metabolic Syndrome, and Obesity in 2022 also highlights the role of autonomic neuropathy in these disturbances. It serves as a stark warning that digestive and heart symptoms at night are often neurological in nature. Sign 7. Nocturia and nocturnal polyuria. Nocturia, defined as the need to wake up one or more times during the night to urinate, is often dismissed as a normal part of aging. However, in the context of diabetes, it is a specific symptom of hyperglycemia, known as osmotic diuresis. When blood sugar levels remain high overnight, the kidneys attempt to filter the excess glucose out of the blood. Glucose acts like a sponge, drawing water with it into the urine, which rapidly fills the bladder. This forces the individual to wake repeatedly to void, leading to significant sleep fragmentation. Beyond the disruption of sleep cycles, nocturia carries physical risks, particularly for older adults. Walking to the bathroom in the dark increases the risk of falls and fractures, which can be devastating for those with diabetic complications. Furthermore, frequent urination can be a sign of diabetic nephropathy or bladder dysfunction. It is a clear indicator that glycemic control is suboptimal and that the kidneys are under stress. A comprehensive review published in Frontiers in Public Health in 2022 highlighted the statistical gravity of this symptom. The study found that diabetes increases the risk of nocturia by approximately 49%. This risk is notably higher in men and those who experience more frequent voids. The review emphasizes that nocturia is associated with impaired quality of life and higher mortality rates. A narrative review in Diabetes, Metabolic Syndrome, and Obesity in 2022 reinforces that this is a major contributor to suboptimal diabetes outcomes. Sign 8. Nocturnal hyperglycemia and the dawn phenomenon. While low blood sugar is a risk, nocturnal hyperglycemia, specifically the dawn phenomenon, presents the opposite challenge. This phenomenon refers to an early morning rise in blood glucose levels that occurs without food intake. It is driven by the body's natural circadian rhythm, which releases a surge of hormones like cortisol and growth hormone in the early hours. These hormones signal the liver to produce glucose to prepare the body for waking up. In a person without diabetes, insulin rises to match this glucose, but in diabetes, this compensation fails. The result is waking up with high blood sugar, despite having normal levels when going to bed.
This persistent nocturnal hyperglycemia contributes significantly to elevated HbA1c levels. It exposes the blood vessels to high sugar concentrations for hours every night, accelerating microvascular damage. It is a sign that the current basal insulin or medication regimen is not suppressing hepatic glucose production effectively. According to a review in Diabetes Care in 2013, the dawn phenomenon is a frequent event in both type 1 and type 2 diabetes. The review notes that the magnitude of this rise can be substantial. Glucose levels can jump 13 to 25 milligrams per deciliter from the nightly low to the pre-breakfast value. This makes it a major contributor to overall glycemic exposure. A study in the Journal of Clinical Endocrinology and Metabolism in 2020 further elucidated the mechanisms. It emphasized the role of nocturnal hyperglucagonemia, where the liver is chemically signaled to dump sugar into the blood inappropriately.